Good evening, everybody. How are y'all doing today?
Good.
Wonderful. So my name's Eladia Reyes, Lala for short. I'm a advanced practice registered nurse practitioner in family practice and urgent care right now. I've been in healthcare for approximately 21 years now, and I love what I do.
Okay, and my name is Christy. I'm a nurse practitioner as well. So my specialty is acute care, actually adult gerontology acute care. I've been an NP for 10 years and a registered nurse for 20 years.
Hi, good evening. My name is Margie Rodriguez. I'm also a advanced nurse practitioner. My specialty is in adult gerontology in primary care, and I've been in nursing for 30 years.
Isn't that amazing? That's like 70 years already, all of us together in healthcare. And one of the great things that we have together is we've been in nursing for such a long time, and we've said, hey, what can we do to help our community and healthcare community? And one idea Christy came up with actually was, how do we talk to people, and why are we putting this together, you know? And it was about, first off, we know that it's difficult to present patients in different manners, right? I know I used to do tumor board, and what do you do weekly when you're presenting your patients?
Oh, daily.
Oh, it's daily, sorry.
Daily, so I'm a hospitalist at Swan Shoreline, Corpus Christi, and every day we have to sit at a table bigger than the one we're at right now. There's about 15 people, and you have to explain what you're doing with the patient. Why did you do this? When are they going to go home? Why did you do that? And so it's like literally being grilled by 15 people at once, including physicians, case managers, therapists.
So it's like the plan of care that you're putting together and why you're doing certain things and
justifying. So if you've never been in that kind of position before, it is very intimidating to be asked questions about everything on your patient, and they're coming from 15 different people. So that was actually the main reason I thought we should do something like this, is because I think a lot of people, especially if you graduated through COVID, a lot of that face-to-face interaction was not there. So when all of a sudden you're put in this position, it's like, I've only done tele, what about Zoom? Why can't I do this? Now everybody's looking at me, and they literally are. So we thought this would help give some pointers, and then also just give a little of our experience.
Yeah, because I think we're all competent people. I mean, and we all met at the same place. We worked locally at a clinic that treated chronically ill adults. And there weekly we had to present patients routinely and defend why we were sending to a specialist or anything like that. And so you get accustomed to presenting those patients just with the experience that we've had, for sure. And it is nerve-wracking if you're not in person and having to deliver that. And it's not to say you're not a competent person if you have difficulties when you're presenting these type of cases, because it is intimidating when you have your peers and doctors asking you, well, why did you order this and why did you send to that? And that test is X amount. And one thing that I know as nurse practitioners is quality care and also effective cost, right? Because we don't want our patients to be costing so much in healthcare and not send them for tests that are unnecessary, of course. So yeah, very good feedback. And I think Margie and I were both like, that's just a great idea, Christy. And all the experience that we have together, let's get on it and kind of help the community and figure out how we can verbalize that in a podcast of some sort. And this is the first one. And so I'm excited, and we're looking forward to talking more about different things. What's a day like for you as a hospitalist, Christy?
Oh, okay. Crazy. Start with admissions. Sometimes I'll have to call 4 specialists just for one patient. Cardiology, GI, neurosurgery.
And that was probably pretty intimidating. Like, how do you get a GI's number?
I've been hung up on several times. But you know what? They call back.
Exactly.
That's the good point. So see, you just learn. They gripe at you and yell at you, and then you hear a dial tone, and I'm like, oh, he just hung up on me. And I'm waiting, and then the phone rings. I'm like, oh, hi, yes, Dr. So-and-so. Okay. life goes on.
Planet
right?
care,
Everything
planet care.
goes.
Let's take care of the patient. The priority is always the
Exactly.
patient. And you're right. Getting hung up on. How do you react? Are you going to get upset with that physician? Or are you going to get upset with that nurse practitioner or your colleague? No. I mean, it was probably in the middle of the night. And
No, it's in the middle of the day.
well, it was their middle. It was their middle of the night. And who knows? But we can all be kind of crabby every now and then, I guess. But at the end of the day, we're all here to help the patients, and exactly. So you let it just roll off your back, and that's pretty impressive that you don't take it personal. And again, like, hey, let's get the care the patient needs. So good. That's interesting, yeah. And I think we've all lived like that as a nurse, right? Margie, do you remember the first time a doc hung up on you?
Oh, of course. It was always intimidating, but I mean, the end result is taking care of the patient. So
And advocating for the patient as nurses,
Exactly.
and I think that was grilled in all of us, especially that old school nursing thought that we all have ingrained in us,
yeah.
is that we're the last line for that patient, and communicating that appropriately is much needed. And so I always love what we do as a profession, So yeah,
Absolutely.
good. Okay.
I'm sure. So we are limiting this to 15 minutes. It is our very first podcast, so we're experimenting as well. And just to let you know, like, if y'all don't know us personally, we are actually pretty funny and sarcastic, but we love each other, so we will, like, poke at each other
Yeah.
a lot of times, but it is all in good gesture, and it's because
We have a
can let it
sisterhood,
roll,
like,
yeah.
for real. It's a
Um,
good sisterhood.
we can let it roll off our shoulders, and it doesn't matter. Just like when anybody yells at you, or even if a nurse yells at you, like, and that will happen. Like, there's some old school nurses that will rip you a new one. They'll rip a doctor a new one too. So it's okay. Right?
Well, one topic I was actually talking recently to one of my colleagues was mental health, right? Because mental health is a big deficit in Texas, in the nation, everywhere. And I know for us personally, even how many codes did you walk out of, and then room 7 needs a water. Lala, go take a water. And we go and smile with the next patient with a glass of water, but nobody really says, hey, how are you handling that, right? And I don't think that's paid attention to much either. And so opening the platform of, hey, yeah, you know what? I had a tough day that day, and maybe that's why the doctor hung up on you, or the NP, or the nurse. And we don't always pay much time or attention to it because it's the day in the life of the nurse or provider. And that was something that was actually brought up to me recently, and we were talking about that. And even COVID, how many times were patients coded and we lost them, and especially in the hospitalist arena, that was acute care 101 there, and nobody is talking about it, but I think there are different platforms that are bringing that up. And so sometimes, telling your colleague, hey, are you okay? Are you okay? Did you have a rough day? Is that why you're upset today?
It's okay to not be okay.
Amen. That is
Yes.
perfectly said. Yes. So, and again, this opens that platform of, hey, maybe Christy was having a bad day that day, or Margie was, and we're talking about that. I broke bad news to a patient in primary care, or hey, this person now has bone cancer in your field. Just various things that we have to shake off and go to the next room about, and we don't really talk to about that with our family at dinner. It's not topics of conversation. And so being mindful of those things, and again, opening that platform is something that I think is good, and stuff like this opens that door. So I like that.
Yes.
So also, we in the future, we will be asking for ideas, or if what you want to learn about. I mean, between the three of us and 71 years of experience, and multiple realms, ortho, hospitalist, primary care.
Advocacy, volunteerism. We do a lot of that in the
Let
community.
us know if you
Mhm.
have any topics that you are interested in, or have a question, and then we can answer. We are definitely doing this, for each other, of
Mhm.
course, and for everyone in the medical field. Nurses, PAs, doctors,
Residents,
residents,
physicians,
everybody,
Uh-huh. Yeah.
secretaries,
Yeah.
ward clerks,
Mhm.
techs.
Everybody
Yeah.
plays a role, and everybody does have those moments, and it's not, again, it's just not talked about, and I like that we can provide a platform for that and move forward together and help each other through those things and topics. So yeah, I like that. I really do. No?
So also, let's see what else.
Well, I had a cool case. This past week, I had as nursing school, we look at all those PowerPoints and presentations, and it was a thyroid patient. And it wasn't a thyroid, I'm sorry. It was an endocrine type patient, though. And you know that picture of that Cushing's patient where it's like thin arms, barrel chest, thinning hair. And it was kind of like, man, and her A1C was through the roof. It was like she was 20 something, and she did pick, it wasn't the picture of type 2 diabetes. It was definitely Cushing's. Long story short, we ended up doing the workup, and she has like a pituitary issue going on, and it was pretty neat to discover in that primary care settings. And it's like talking about those different cases and bringing that, oh yeah, that's that picture that we saw back in the day of Cushing's, and putting that puzzle together was fun. Any interesting cases you were just sharing with us? Yeah, that was pretty neat.
Yeah, so I love genetics. I love learning about it. Actually authored a paper that is published in the Journal of the American Association of Nurse Practitioners, that's on genetics and genomics. But this week, I actually learned, which I think a lot of people already knew about it, but I surely did not, is that you test for the BRCA gene in men, and it is a thing, and it causes prostate cancer. So we always just think, or I used to think of the BRCA only being in females, so if you have the BRCA gene, have your girls get a mammogram, but never had I ever thought about, oh, what about my son? Does my son need to be tested? Because, and then I just always thought it was only females, but of course men can carry it, but I didn't know it would affect them. I thought it was just like a carrier gene that they could pass on, but so that was world eye-opening for me, and
it's amazing that you can always, in healthcare, you're always learning. You never know everything, and honestly, I've always said this to many students: is if the minute you think you know everything, you don't. You just don't.
You should stop.
Or you're lying. You're lying if you know everything. And so And that's the beauty of it. It's healthcare is always evolving, just like our profession's always evolving. From the Crimean War to now nurse practitioners. With Loretta Ford. It's just amazing how it's constantly evolving, and you don't know everything. We will constantly be learning, and I think that's one thing that I love about healthcare, because I love thinking, and it's always challenging, and you never know everything,
I have
So
one more too.
yeah.
This is
Oh
just
yeah.
funny.
No, that's good.
So old school, right? We used to do guayacs all the time, right? You just put your finger up there, get some stool, put it on a little card, turn it over, the drops. You see if it's positive or not. Well, a resident schooled me a couple days ago that is not recommended anymore, according to the American Association of and I quit listening by then. And I just said, what? You mean we don't do the card with the purple? And he was like, no, that is not recommended. I was like, oh, okay. So yeah, no more guayac stools. That's only for old people like us.
Yeah. I didn't know that.
Interesting.
I didn't know that.
I didn't know that either.
I was like,
What was the reasoning for it, or was it?
I
You
stopped
stopped
listening, but
listening?
it was like some American Association of probably gerontology or somebody recommend this, and it's not recommended.
Probably because of hemorrhoids or something. That's what I would
or
assume.
maybe like
False positive.
yeah.
False positive.
or they
pathology.
actually need probably further testing to check for colon cancer, stuff like that.
Yeah.
That you would just stop at, oh, it's negative, and then nothing happens.
Interesting.
I really don't know, but
That's interesting. That is interesting though. Something to look up.
Yes.
Well, it's always like even the prostate, where people are always talking about the prostate, we don't do it anymore. It's not recommended because
Oh, really?
yeah, it's not recommended to do the look at. She's like,
I
oh
learned,
really?
like, remember, what do they call it? What does it
The
feel
GRE,
like?
yes.
I know, but
Yeah.
what do they call it? Like, does it feel, that name, like,
Like a heart. I always remember it being.
but
like a
if
heart.
it feels like more squishy, that's not good.
Yeah.
But there's a term for it. Like,
Yeah.
you're like, ooh,
Yeah.
that feels like.
Honestly, learning it, I never ended up doing it, because of the data and just doing the PSA. And So I save that for urology.
And turfing.
I do. Know your lane. Know your
Yeah.
lane. Know your lane. And that was not in my lane.
And know what you don't know. And you're like, that's a zebra.
You gotta go. If you gotta check that, you are in urology's office, and I won't put a patient through that twice. So there you go. That's my
Well,
reasoning.
Yeah. All right, ladies, and whoever is watching out there, that I think is it for today. So I don't know how often we're gonna do this, but please join in, and we will let you know.
Thank you.
Good night.
Bye.